Guys, this channel focuses to discuss some important Neet PG topics. Stay tuned, do like, subscribe, comment, and share.
Hello guys, this is Dr. Shivaam and I'm again back with you. I know your exams are coming too near and I'm also not getting that much time. So I'll be discussing few important topics from my made notes which will be very important for you. I'll be discussing only the question asked from this topic without wasting time, and I think that you will find it very useful. So in this picture, as you can see, the question that is asked is what is flip pattern of LDH? As you can see, the LDH have 5 patterns, and in case of MI we see flipped pattern of LDH. That is, what is it? It is that the LDH1, the value of LDH1 is greater than LDH2, while normally what is it? Normally we find LDH2 greater than LDH1. So question they will ask is in MI what will be the value of LDH, means in 4 options you have to select that LDH1 will be greater than LDH2. Now proceeding to another slide, it is made for xeroderma pigmentosa. Now here they ask why it is caused. So it is basically due to accumulation of thymine dimers and due to exonuclease enzyme deficiency. So UVABC exonuclease, not exonuclease, not endonuclease, but exonuclease. So you have to remember the exonuclease enzyme deficiency, and the thymine dimers or the thymine adducts are found. So basically it is a autosomal recessive disease. Now here you can see 3 types of biological transmissions. So basically 3 types: the propagative, cyclopropagative, and cyclodevelopmental. Now what they ask is which of the following organism or disease follows a cyclodevelopmental. So filariasis and dracunculosis follows cyclodevelopmental. Does it mean is that they do not multiply but show different developmental stage. So biological transmission is by different developmental stage. In propagative only multiplication, in cyclopropagative it is multiplication, and that will be in cyclical. In cyclodevelopmental there will be no multiplication, but that development will be there. Propagative is seen in yellow fever and the plague. Cyclopropagative is for malaria. Now another important thing which you can note here is transstadial transmission. What does it mean? It means from egg to larva to pupa, like the transmission will be like this. So ticks and mites also shows trans ovarian and transstadial transmission. Who else shows? Dengue. Dengue shows trans ovarian transmission and have a vertical transmission. So for dengue you have to remember, dengue is a very important topic. You have to remember that it shows a trans ovarian and transstadial transmission. Now endemic fluorosis is very important, very frequently asked question. So the normal level, the safe limit in India is 0.5 to 0.8 milligram per liter. In foreign countries it is 1 milligram per liter. Now the level which causes skeletal fluorosis is 3 to 6 milligram per liter, and if it goes above 10 milligram per liter it causes crippling fluorosis. Okay, dental fluorosis 1 to 2 milligram. Now what is Poker's spine? They have asked once what is Poker's spine. It is advanced stage of endemic fluorosis. Now what techniques you see to prevent the fluorosis? So you all know Nalgonda technique, where you add lime and alum and you do flocculation, sedimentation and filtration. Now this is regarding chlorination, another important topic from community medicine. So after 1 hour of contact period, the residual chlorine should be around 0.5 milligram per liter, greater than 0.5 milligram per liter. Now in case of disaster, after disaster it should be superchlorinated water, that is greater than 0.7 milligram per liter. In swimming pool it should be 1 milligram per liter. Now in water infected with cyclops it should be 5 milligram per liter. Chloroscope is the amount of residual chlorine. Chloroscope is an instrument used to measure the amount of residual chlorine. Now in case of highly contaminated water, how you will dechlorinate? You can dechlorinate it depending upon the area. Means if it is a larger level or larger area, you need to superchlorinate it followed by dechlorination, and if it is a smaller area you can just use the reverse osmosis process or instruments. Now what is chlorinator or chloronome? It is a device which is used to add chlorine in water, chloronome. Now what is the thing which acts? It is the hypochlorite ion, the hypochlorite thing, that is the HOCl, which is used for disinfection process. Now there are two different tests, that is the orthotoluene test and the orthotoluidine plus arsenite test. So orthotoluidine test is for measuring both the free chlorine as well as combined chlorine, while the orthotoluidine arsenite test measures it separately. So both are a separate different question. Now coming to another important thing that is related to water is waterborne disease, water related disease, and the water based disease and the water wash disease. So if you see water related disease, so these are basically the diseases which are related to water, like the dengue, chikungunya, malaria, means the vector are related to water. Water based diseases, the organism are needing the water for their life developmental. So guinea worms, dracunculosis, these are diseases which are water based disease. And water wash diseases like scabies, which are caused if they do not maintain the hygiene and all. So you need to note these diseases. These are a separate question. Another question which is asked is Bangalore method and indoor method. So Bangalore method is basically an anaerobic process of composting, while indoor method is an aerobic method of composting. Now there are different child placement agencies. This is a very rare, but they do ask this. So you should know what is Bostel, what is remnant home, what is remand home, what is juvenile home, and what is foster home. So in Bostel, basically the boys of 16 to 21 years and girls of 18 to 21 years who have done crime are put under IG police for 3 years. Now what is remnant home? Now you suppose a child of 11 year, a boy of 11 year does a crime, so he will be put in a remand home under the medical counselor for behavioral change. Now if he goes beyond 11 to 16 years, he will be put in the Bostel. So primarily मतलब पहले उनको हम रिमांड होम में रख रहे हैं अंडर द मेडिकल काउंसलर. फिर जैसे वो बड़े होते हैं, फॉर बॉयज़ ग्रेटर देन 16 years up till 21 years, for girls greater than 18 years up till 21 years, they are kept in Bostel, and before from 11 year to 16 years for boys, and for girls 11 year to 18 year they are kept in remand home. Juvenile home is for 11 to 19 years, then not followed now. Foster home is the child will be kept with families that are not of their own till then they are adopted by someone. Now another important thing is Millennium Developmental Goal, where the question they ask is how many goals are related to health. So basically 3 goals, that is the 4th, 5th and 6th, are directly related to health. These all 8 goals you should remember. These are very easy, and Millennium Development goals have 8 goals, 18 targets and 48 indicators. Now regarding immunization, this is a very easy and very frequently asked, that is the mission Indradhanush consists of how many diseases, means they aims to prevent how many diseases. So 7, basically the DPT, diphtheria, pertussis, tetanus, then measles, polio, hepatitis B, and the thing which you forgot is childhood tuberculosis. Okay, so I think these 4 new vaccines which are launched, you all know: IPV, JE, Hep B, rotavirus, rubella. IPV given at 14 week, and it is a part of end game strategy. Now one more slide I want to show you is that this thing from biochemistry, they are very fond of asking the enzymes present in different, the metalloenzymes, the metals present or associated with different enzymes. So you should note all of them and should revise them before 15 days of your exam, and you should try to make mnemonic and remember anyway, so that you remember. Copper is superoxide dismutase, monoamine oxidase, lysyl oxidase, cytochrome oxidase, ALA synthase, all for copper. Zinc is carbonic anhydrase, alcohol dehydrogenase, carboxypeptidase, ALA synthase, ALP, LDH, RNA polymerase. Molybdenum is something which they very frequently asked. Xanthine oxidase, sulfite oxidase, aldehyde oxidase. Selenium is also very important. Glutathione peroxidase, 5D iodinase, thioredoxin reductase. Iron, you all know, cytochrome oxidase, catalase, peroxidase, proline hydroxylase. I know it seems difficult, but if you read them frequently, it will be memorized. And I know you can do it. So all the very best. I'll be back when I get time. Till then, study hard, stay motivated, and you can achieve this. Thank you.